Hello, my name is Francesca. I am a cancer nurse and an exercise coach for people who have a diagnosis of cancer. I have cared for people who have cancer for over 30 years and recently, with my colleague Claire, set up a community interest company with the sole purpose to support those receiving cancer treatments to remain physically active. As a cancer nurse, a frequent question I am asked is exercise safe for patients? The simple answer is yes. In some cases, there may be some restrictions, but as long as you have discussed any concerns over with a health professional or an exercise coach, a plan to continue exercising can be made. A research study by Macmillan Cancer Support looked at people's perceived differences between the terms exercise and physical activity. Exercise was considered to be more rigorous and more associated as formal or a sport, likely to be high impact. Examples include running or going to the gym. Physical activity, however, tended to be more associated with older people and included tasks such as gardening or housework. It's important to recognise that any of these activities result in movement and can benefit you. Why should we exercise? It's important for everyone to take part in some physical activity, but for those who have a cancer diagnosis, we know there are additional benefits. There has been considerable amount of research on the benefits of exercise for cancer patients, and one main benefit is the impact on fatigue. The assumption is that if you have fatigue as a side effect of treatment, then any physical activity will add to the fatigue. The opposite has been found. With the guidance of the correct amount of physical activity, fatigue can be managed. Another main benefit is that regular physical activity, at least 4 to 5 times a week, at a moderate to vigorous pace, can decrease the risk of a cancer recurrence. Moderate to vigorous pace would be if you are walking with a friend, you walk at a pace that leaves you with a little flushed in the face, a little breathless, but still able to talk. Being active can help with everyday physical function. Housework such as ironing, washing and dressing, playing with your grandchildren, opening and closing doors, and the ability to continue with your job role. So what exercise should you be doing? Aerobic exercise. This is where you use your larger muscles for any rhythmic, continuous activity, such as walking or running. Ideally, aim for 3 to 5 days a week, but ensure that you have rest days. The aim is for 150 minutes of activity a week, but this can be broken down to 30 minutes a day, or even 3 lots of 10-minute bursts. The aim is to start small and build up gradually. Strength training. This may be body weight only, for example, doing a wall press-up, using hand weights or resistance bands. Ideally, at least twice a week, with rest days in between. Start with light effort and build up gradually. Flexibility and balance. This can be gentle stretches or balance movements, for example, standing on one leg for 30 seconds. We lose our muscle strength naturally from the age of 30, and cancer treatments can negatively impact strength. It's very important to regularly do some balance exercises. Daily is ideal, but whenever it can be incorporated into your daily life. The impact of cancer treatment can be huge, with many side effects, some of which can be long-lasting. Fatigue, reduced muscle strength can affect motivation to exercise. Pain, incontinence from treatment, and breathlessness can all be barriers, but with the right support, there is always an option to adapt and incorporate some activity into your daily life. Your own social network of friends and family can be a motivator and also a barrier to exercise. Loved ones naturally want to take care of you and may take on more of the housework, shopping or jobs that you used to do. Whilst this can help in the short term, it would be more beneficial if friends and family can support you to continue to be active. You may be more likely to do the 10-minute walk if they go with you. So what options are there? Claire and I are both level 4 cancer and exercise specialists who run 4 classes a week for anyone recently diagnosed with cancer, currently receiving cancer treatment, or who have finished their treatment. Our classes are for men and women and cover cardio, strength, flexibility and balance. They're a lot of fun and a great support as a group. The classes are funded and currently free for up to a year post-treatment. A referral is required that we can both organise for you. please feel free to call us to discuss further. The urology team have our details, or you can access them at Millen Centre at Southend Hospital for more information. Our top tips: start small if new to exercise, reduce the amount of time sitting or lying down, consider exercising with a friend or family member, don't exercise if you feel unwell, drink plenty of water and ask a health professional for advice if unsure where to start. Thank you so much for listening, and if I can leave you with these 3 takeaways: set small goals for exercise, remember our bodies are meant to move and it's never too late to start. Thank you.